Hi, my name is Fred, and I am going to share with you some information that I learned and do a case conceptualization of a case that I just spent time with. I just interviewed someone named Wade uh, who offered to do this interview for me to satisfy this particular assignment. So let me tell you a little bit about what I learned about Wade. Um, first of all, his appearance was normal. His hygiene was good. And he is a younger man. He's about 29 years old. His behavior was appropriate. He seemed alert and he was very much plugged into what we were doing. However, I will mention that there was a little resistance at the beginning. He seemed a little bit nervous, but I think that as we rolled on with the interview, he was able to sort of loosen up and share more about his life and what was bringing him into therapy. Um, he His thoughts were congruent. He didn't have any sort of rambling or pressured speech or anything like that. And he seemed to be able to process questions without much struggle. He didn't really get stuck too much. Um, and he didn't seem to exhibit any strange behaviors such as auditory hallucinations or visual hallucinations or anything like that. He managed to stay right along with me in this. So let me tell you a little about him and what I learned after kind of sharing that piece. There are two things that are important to point out. One, he did mention symptoms of depression, and though he's never been diagnosed, when we get to diagnosis, that's something we're going to look at. And the other thing that came out was substance abuse. He did talk about an alcohol problem and something that he struggled with early on in his life and had some time sober and recently had relapsed. And there's actually three. Third piece is the grief. He endured a recent loss, and his drinking is a sort of a solution or a result to what happened after this loss happened. So Wade is a 29-year-old Caucasian gay male. He's single, and he spent most of his life in Southern California, growing up near the beach. He describes himself as a beach bum. So there you go. He struggled with alcohol at an early age. From what I can assess, he comes from a family that had some dysfunction, and he also described his family as an alcoholic family. So with that, he sort of moved around a lot, and that kind of moving around can really cause sort of like separation anxiety. He could be experiencing like detachment from people, and it could also develop trust issues with individuals, and it could also affect future relationships. Um, you know, we talked a little bit about his sexuality, and he is a gay man, but he describes it as not being an easy road for him, and common with a good percentage of gay men who go through sort of the early stages of discovery. They may experience feelings of being different, or they may even develop shame around their sexuality based on what they're hearing from their environment. One thing Wade offered was his pastor actually said to him, that basically that being gay is wrong. So he sort of had that message from an early age. Interestingly, though, it didn't come from his family. His family, um, it sort of comes across that they wanted to make sure he was safe and okay, but he did have to sort of move around a lot, and that did cause him some problems, like he had said. So, kind of looking a little deeper into this case, um, he said that grief was his trigger. So when he endured this loss, he started drinking, and the drinking progressed rapidly. After having 7 years of sobriety, his drinking progressed rapidly, and to the point where he ended up making a decision to take care of himself. And for a person who has experienced recovery from alcohol and returns to active usage, they tend to have a couple of things going on. One, they're going to have sort of this new shame that might show up or something like that. And it might be harder for them to actually quit because of that level of shame. And he's rather fortunate because he was able to stop before it progressed beyond what it was. He did seek treatment. He went to detox, and then he came to me. And what I could really assess here, like some of the things that really need to be addressed are his grief. It appears that his grief hasn't really been dealt with, and he did ask for a grief group, so at least he's sort of reaching out and thinking, okay, well, I got to deal with this thing. And so this is definitely a positive direction that he's in. Some of the other things that come to mind, he didn't really mention any intimate relationships, and I would want to ask him like more about what his intimate relationships have been like in the past. Coming from a dysfunctional family, sometimes it's hard for people to develop like a healthy ideal of what relationships should be. So he was pretty forthright though with his information, and again, like I said, he was pretty willing to work with me. He is a person of talents. He did describe some of the things that he's good at. He said he's a chef and he's good with people and that he's kind. And those are really important attributes and things that he could really build on. So as far as diagnosis would go, we have a couple of things like I mentioned. He does have grief to deal with. It's hard to determine the depth of his grief. However, the fact that he is seeking help to work through it is definitely the first step towards healing. And he also has a substance use disorder. In this case, I would diagnose alcohol use disorder. It's kind of borderlining between moderate and severe. He did pull out, however, he did have to go to detox, so I would have to go a little bit more on the severe end, and diagnosis code for that is 4.10.20 in the DSM-5. So you got alcohol use disorder, severe, and then he also talked about depression. And he said he had never been diagnosed with depression, but he did have enough symptoms to sort of direct toward that diagnosis. I would have to ask a few more questions just to see if he actually meets the full criteria for a major depressive disorder, but he may have sort of a mild version of depressive disorder. Code for major depressive is 4.32.5, or excuse me, F.32.5, and that's from the DSM. So I would say that we're dealing with grief. We're dealing with alcohol use disorder, and we're dealing with depression. There probably has to do, he'll probably have to do some work around shame because from the sound of the interview, though he's worked through quite a bit of his shame, he's still identified with internalized homophobia and how that will still appear periodically, and that would imply that there's still a part of him that he hasn't fully accepted, and I don't doubt that if he continues working on that, he'll be able to sort of find a way to fully accept his sexuality. And once he works through these issues, he could really start building relationships, building self-esteem, and really kind of getting past what happened to him here. It would be important for him as well to return back to his groups. He had mentioned something about returning back to his fellowship, his 12-step fellowship, and that would probably be a great source of support as well. So there you go. There is our conceptualization of weight, and I thank you for listening.